Okay.
Turn your camera on too,
Yeah, that would be good.
maybe. How about now, Suzanne?
Okay. Yeah, we're getting sound. We just started getting sound.
All good.
Okay.
Thank you.
All right. So we're talking about anxiety, and we're talking about what it is and the different types of anxiety that people can experience. It's very common, as we talked earlier, and many people have it and don't even realize they have it. So it's helpful sometimes to have some information on it. So worry is one form of anxiety. So some people know that their grandmother always worried, but they don't really know that that's type of anxiety. Can be a type of anxiety if your grandma was a worrier. Maybe your grandma might have had anxiety. Some people carry that into their generations, and so they can be worriers also. Some people just are generally nervous, and the nervousness can be a form of anxiety. Some people have apprehension, like you're kind of afraid before you go into an elevator. You might have some apprehension about that. That can be just a small amount of anxiety. Then anxiety can also be in the form of fear. Some people have a fear of larger things happening. Some people have even a fear of meeting new people, or a fear of going over bridges. And then some people, anxiety can be even in the form of dread, especially for things like anxiety attacks. People sometimes have a feeling of dread of something's going to happen, even if there is no evidence of something happening. People can experience tension in their bodies and tension in their mind for anxiety, or restlessness. Another symptom of anxiety can be irritability. Many times people don't recognize that irritability can be a sign of things like anxiety or even depression. And so a lot of times people say, oh, they're really grouchy, but sometimes they could be grouchy because they could be anxious. And so it's helpful when people are experiencing these things to ask for more information and more clarification, because it's easy to misinterpret what somebody else might be going through if we don't check in with them. And then ultimately, these different types of feelings are very uncomfortable. Can we all agree? Like nobody really likes having these kind of feelings. And so that leads us to want to avoid situations that may cause or exacerbate these types of symptoms. And then that avoidance can sometimes make anxiety worse, because as you avoid it, then you don't really ever get used to it. And then it's like this thing over there that you walk around and you create your life around, and it becomes a self-fulfilling prophecy. And it's really common. Sometimes people don't even realize they're avoiding something that's anxiety provoking. So there's many different types of anxiety. So we're not here to be a diagnostic and talk about every type of anxiety. I just want you to have some general information and some tools to be able to help think more about this and how you can navigate it if you want to learn more and make some adjustments that maybe help you feel better, both in your mind and in your body going forward. So some of the types of anxiety that people experience are like a generalized anxiety we talked about, where people are excessively worried, uncontrollably worried all the time. A lot of times when people have like a general anxiety where they're worried all the time, they've lived with it for so long they may not even realize it. It might be this low grade, uncomfortable feeling that they don't even realize they have, until something else happens where it is another layer of anxiety, where a situation happens that's really uncomfortable, and then they get anxiety because of that situation, some encounter they had. And so that's when it becomes tricky, is some people can have a low-grade anxiety and then have another anxiety on top of that, which then makes it even more so. So what I like to say too is anxiety can be contagious. It's really not like a contagious disease in any way, but it is kind of contagious in the sense that one person will be like, oh no, there's this, and they'll be worried about something, and then next thing you know, another person can get worried about that. And so it tends to kind of spread like, oh no, look, the weather's coming and we better batten down the hatches because the storm's going to come and we're going to have flooding and things like that. And then the next thing you know, someone else can be afraid of that too. And in actuality, maybe that's really not what's going to happen right at that moment. But it just can kind of snowball from there. And then the same is true about controlling anxiety. You can reality check with another person and say, you know, have you seen the weather? Do you know what it looks like really outside? And you can make a plan that's more reality based. And so I see a lot of you do that in here on a regular basis. I don't think you realize that you do that sometimes, but you check in with each other. When you're concerned about something, I see you guys check in with each other. That is a really healthy way that a social community can support each other, and it actually reduces anxiety even when you don't realize it. You know, if you're not having the best day and I see you check in with each other and encourage each other and find ways to support each other, and that actually brings down anxiety. And then there's another type of anxiety that's a trauma-related anxiety. So a lot of times we think of a trauma as being a big event, maybe something that happened in a war situation or things like that. That is true, or some type of a crime or something that people experience, or a big motor vehicle accident. Those things are traumatic, but we can also have smaller traumas or even medical traumas where if you had some big medical event or a family member had a medical event and they had to go through a whole lot of things and it maybe changed some of their life, that can feel traumatic and that can be real. And so then it's important to be aware of these types of things so that we can address them as they go, and we can help hopefully reduce the amount of anxiety surrounding any of those types of things, because it really does impact your quality of life. So today we're going to focus on dealing more with specific situational anxiety. So an example of this type of anxiety can be giving a speech, especially when the sound doesn't work. And also a new situation that's unknown. So like thinking back of when you first came in the door here and you'd never been here before and you weren't really sure of the situation or what the program was going to be like, if it'd be a good fit with you, that can cause normal anxiety. And then hopefully that anxiety comes down as you realize you fit in and that you have a place here and that you have a plan to be improving your health. Some people will also worry about their health condition. That can be a normal type of anxiety that can actually help motivate people to improve their health. So this is where anxiety can actually be helpful, and it can motivate you to make a change to improve your health. But when anxiety becomes a problem is that when it continues even after your health is starting to improve and you're making a plan, but it doesn't dissipate, it doesn't improve, then maybe there's something else we need to do to kind of help that situation. Same thing with like test taking and exam. Anxiety can help you before a test get energy to focus and can drive you to like make the time, because I feel anxious about the exam. I'm setting aside time to focus and study on it, which you may not if you're not worried about the test, right? But when it gets to be so much that you feel overwhelmed and you can't remember the information, that's when we need to do some things to help improve it and bring the anxiety down. So anxiety can be a motivating, helpful thing, but there's a point when it gets really uncomfortable and it gets in your way. That's when it's good to do something about it. And so one of the reasons why anxiety can be a problem is that it used to be called just the fight or flight, but more recently now it's called, they added freeze. The deer in the headlights kind of a freeze thing is that when people get into a situation where they feel anxious, and they recognize that they feel anxious and they're thinking about it, your body starts to jump into action. And back in the jungle days, that worked really well, because when people lived in the jungle or in primitive situations and some animal jumped out, this enabled them to escape. So the body creates all this adrenaline, this cortisol, and it jumps into action, and it creates like a faster heartbeat and all these things to help you run from the tiger in the jungle. It also creates a tunnel vision so that you can just see your way out. So all that helped back in the day. But today we don't live in jungles. And so when we get anxious and we get really anxious and that fight or flight kicks in, we get more of a tunnel vision. So it's harder to hear other people trying to help or to problem solve on kind of the outside. And then our bodies kick in. So our heart rate goes up, our blood pressure goes up, our breathing becomes more rapid. And it can take up to 20 to 60 minutes for that to come down to normal. So keeping in mind things like your blood pressure and things like that, if someone had some type of a cardiac event, and then they had to have some procedures and things, and then they start to see more healthcare professionals, sometimes that's where like a white coat syndrome is what you hear can come from, because when people see the white coat and they think about the health professionals, they think about their cardiac event and they think about the things they had to go through sometimes. And if this starts to kick in, then you can have an elevated blood pressure, elevated heart rate, and it can take from 20 to 60 minutes to kind of bring that back down to where you start to feel like you're in a better place. And this is why sometimes the nurses will say, can we have you just rest for a few minutes and everything's okay, and we'll retake your blood pressure, because sometimes taking it later when you realize, oh, I'm okay, that's just like a new situation that reminded me of an old situation. And then many of you probably don't realize it, but you have coping skills you're already using. You have things you're already telling yourself to help yourself feel better and to help yourself get motivated and to get where you need to be to help your heart, because you wouldn't be here if you didn't. So that is a really important thing also to think, that you probably have skills you don't even realize you have that you've been using for years to get you places. Otherwise, we wouldn't even be here. So the impact though on that over time, if your body is constantly in this fight or flight place, and it feels like it's trying to escape danger, it can actually have negative consequences on your body, because you don't want your heart rate and your blood pressure and everything be up over extended periods of time. And then it also can be exacerbated by imaginary threats. Like some people, even after they get treated for their cardiac events and they get their medications and they get more stable, can still be so afraid if anything changes that they imagine that something else is going to happen again. And then they can create, in a self-fulfilling prophecy, they can create their heart rate to go up and things like that. So that's why it's really good to find ways to be able to manage that and to be able to think about it in enough that you can recognize when it's happening. And the earlier you can catch it, the less negatively it will affect you physically. So understanding the body's natural fight or flight response is one way to help you cope with situations. When you notice that you're becoming really tense or that you're feeling kind of anxious, you can start looking for ways to calm yourself down. The sooner you recognize that, the quicker you'll be able to make a change. What happens is it's so uncomfortable, people try to avoid it frequently. And our society tells us to push through it, to keep going, to be successful, you need to like overcome it. But the key is to recognize it and deal with it and slow down and go easy on yourself so that you can then calm all of your hormones and your body down and then move back forward. And because the messages we get in society are kind of the opposite, it's important to practice it. You have to practice these skills just like exercise. So one of the ways that all of you do it is you're developing a healthy support network, because you do it every day in here. I watch you do that. A healthy support network makes a very big difference in how people deal with any adversity they're going through, and then also how people do life. And so that can reduce anxiety. Engaging in exercises and both relaxation exercises where you practice mindfulness, you practice meditation, you practice taking breaks when you need it, downtime, things like that, sitting in nature, getting physical exercises, because we talked about all those hormones that start in your body. When you do get anxious, exercise gives you a way to use those in a meaningful way. So for example, where the running out of the jungle thing we don't need that, but if we have all the energy in our body, we need to use it somehow. So it doesn't just sit in our body and make us feel worse. But if we exercise, you put all of that to a useful purpose, and then it can help your cardiac wellness in a whole different way. So physical exercise is a very well-researched way to help with anxiety, because it gives your body a way to use that energy, and then it can help bring things back down afterwards in a more relaxed state, and it can make a difference. Also, getting regular sleep helps people be able to deal with the things that are happening around them, and it helps your body be able to have time to recover. And then practicing deep breathing techniques and mindfulness exercises. Those things also help. So one of the reasons that mindfulness can help is that many of the worries and anxieties we have are not just happening right now. Many of them are related to the past and the future. So if I'm worried about a cardiac event that happened in the past that I think might happen in the future, but I'm okay right now, I'm worried about past, the future, and the present all at the same time. And so that can feel really overwhelming very fast. So one of the best ways to help yourself center when you feel the past and the present and the future all kind of piling up at the same time is to train yourself to focus on the present moment, the here and the now. What's happening right in front of me? Am I okay right now? Is my blood pressure okay right now? Is my breathing okay right now? And that is what mindfulness also does. It helps you refocus on the present, because you really can't solve problems that happened in the past anymore. And we really don't know what's going to happen in the future. And for sure, we can't deal with the past, the present, and the future all at once. So the present is really all we have. And if we feel better in the present, then we'll be able to manage the next moment better. So that's one of the things that the research in mindfulness has really shown that it's helped. It didn't maybe cure people's problems. It didn't maybe stop them totally from worrying, but it helped them focus on what in the here and the now and the present. And all the research has shown that it reduced pain, it reduced anxiety, and helped people's health improve just because they were only focusing on the present moment. And so we do have some mindfulness exercises here once a month, and I'm hoping to add some more in for that exact reason. And all of us, it's important for everyone to practice mindfulness, myself included. The activities that help return your mind to the present moment help you also focus on the task that you're doing at hand, because like distracted driving usually is when you're thinking about and focusing on other things, not focusing on driving on the course that you need to be. And so it's the same way where you're driving life and you're driving your body. You want to be focused on where you're going and not trying to multitask too many things at once. So some of the things too is when you all play mahjong, you're focused on the present moment. It helps you focus on the present moment and your next move. And so it can help center you. Those different types of activities, cooking, when you're cooking and preparing meals, and when you're eating and you're focusing on the flavors of the food and how you chew it and how you eat it, that's focusing on the present moment. Those are things that you can do to help keep yourself present with mindfulness. Same thing with exercising, focusing on your body, on the current and the present activities that you're doing and how your body's helping you. Those practices that you do like that, those actually help you for the long term because you're practicing staying present, and that will help reduce anxiety overall. Another way is to engage your 5 senses. Is that if you feel like you're getting rattled or really like anxious and you feel like you need to kind of center yourself back down, focusing on your hearing, your smell, what can you see, what can you taste, and what can you feel? If you ask yourself those types of things, each of your senses, it can help you recenter yourself in the present moment, because it's hard to think about what we can see and what we can taste and what we can feel and be in someplace else at the same time. That brings us back to your present moment. Also, focusing on your breathing. So one of the easier ways that I found is called square breathing, where if you want to bring yourself back to a calm state, if you take 4 deep breaths in, and then you hold it to the count of 4, and then you exhale to the count of 4, and then you wait for 4, and then you take another 4 in. It helps pace your breathing, and it gives you something to focus on that's right here in the present moment in your body. There's a lot of different types of counting of breathing, but I feel like the simpler, the better. So that's why I like the 4 square breathing, but you can try all kinds of breathing exercises that you think might help you. There's also belly breathing, where when you breathe, you try to feel your belly go out, and that's how you know you're taking a deep breath, and then feel your belly go down. And that helps you also with the touching, feeling, seeing, breathing, smelling. It helps center all those things. So some of you all might have heard about some of the different types of exposure therapy. That's frequently recommended and therapists can help people with that process. It also goes kind of back to the old adages of look fear in the face and jump back on the horse. Those kinds of things were oftentimes things that people said back in the day. Anxiety can cause people to avoid experiences and events because it's so uncomfortable. In some cases, it can be painful. But then continued avoidance of those things just actually exacerbates the problem, because you never get past that if that's the case. There are some things you may never have to do again in your life, and so that might be all right. But if you had an accident driving down a certain street and then you avoid that street all the time, do you think you're ever going to feel comfortable driving down that street again? Probably not, unless you have a positive experience. So the thing about the jumping back on the horse or pushing yourself too hard through it is, if you try to drive down that street and push yourself through it, and when it's already, the traffic is there and it's really busy, chances are good you're going to have that same anxiety experience again, and then you're going to want to avoid it even more. So what we want to do is bring that down to where you make it easier and simplify. So when things feel too big, we want to make it simpler. So where you could possibly walk down the sidewalk of that street, or have somebody else drive down the street and you ride as a passenger with them when it's not as busy. Anything we can do to bring down the anxiety and do it in smaller amounts can be key to helping address that situation. So, for example, if you have anxiety about doing some kind of a exercise, doing it in smaller amounts. You know, that's why the nurses will encourage you to just try, just do a small amount and just see how it goes. But if you try to push yourself to do too much when you have anxiety and then you're doing something physical, then you're probably going to have more of a negative reaction. And then you're going to say, see, I couldn't do it. So smaller amounts and baby steps are better when you're feeling anxious, because you have to remember your body is also working extra hard, because when you're anxious, you have the other hormones in your body. So you have to be kind and gentle to yourself. And then if you see the positive steps that you're taking, then you're more likely to be able to progress past that. So that's really been the key, and something that's come out of more research rather than pushing yourself too hard. It really is good to kind of take a step back and break things into smaller steps, because nobody really ever climbs the mountain overnight. So you climb the mountain one step at a time. So also healthy lifestyle choices can help with anxiety, and I see you all trying that on a regular basis. Research has found that reducing caffeine, not getting that triple double latte thing at the drive-through, and can help manage with anxiety. Not saying you can't have your coffee, I'm a coffee lover, so, but just being mindful of not overdoing it, especially at the time of day or in a situation where you know might be more anxious than others. And then the mindfulness practices, and then getting enough sleep. Those are other things you can do to help yourself on a regular basis. Some people might also need to see a therapist and have a therapist help them with walking through this process and giving them support. And that is a very common thing therapists do. Also, some people might be interested in prescription medication, and that would be something to talk to a doctor or a psychiatrist about, because doctors and psychiatrists are the ones that can prescribe. So one of the most well-researched treatments for anxiety disorders or anxiety symptoms that people do in therapy is called cognitive behavioral therapy. So cognitive behavioral therapy works on the idea that anxiety didn't just happen in itself. It doesn't just happen, that we think about it, and that's what creates the anxiety feelings. Our thoughts create our behaviors. So it works on the idea that our thoughts can either make anxiety worse or they can make anxiety better, depending on how we perceive things or we view things. So a cognitive behavioral therapist or a therapist that uses those tools will help people identify patterns and thoughts and techniques to maybe reduce the anxiety. So one of those things could be worry journaling. It's a technique that involves writing down all your worries and then seeing if those things happen and checking off how many of those worries happen. And chances are good that all the things we worry about every day, you're not going to check off every one of them that really happens. But sometimes just seeing it on paper helps you see, like, reality check that, yeah, I was over worrying. Another thing that happens is, and cognitive behavioral therapists help people with this, it's called black and white thinking. So sometimes people will say, everyone is smarter than I am. Well, do you think everyone in the whole world is really smarter than you? Probably not. But when you tell yourself that everyone in the whole world is smarter than you, and frequently it goes with that, I never do anything right. Those two things tell your mind and your body that, like, there's no way to overcome that. Because if everyone is smarter than you, then it's an insurmountable problem. And black and white thinking is something that starts when little kids have black and white thinking, because that's how their brains develop. So you'll hear them, everyone has this toy and I don't have one. That's the black and white thinking. So we all know as parents, everyone in the class doesn't have that toy, but they feel like really left out if they don't have the toy that they think everyone had. And so it leads them to feeling worse. So when we grow up, if we continue some of that type of thinking, it can lead us to feel bad about ourselves and bad about the world around us. And it can increase anxiety. So usually black and white think is when we overgeneralize, and it happens to everybody. And so when you realize in a time you're saying everybody, always, no one has ever had this feeling that I've had before. Well, if you feel like no one's ever really felt that way except you, then it makes you feel bad. So, but potentially someone else has felt that way in the whole entire world. So kind of recognizing if you hear yourself always, no one, those types of things that are really large, painting society with a very large paintbrush that seems insurmountable, really asking yourself, well, is that really true? And the therapist can help people who have a tendency to do this more often, but sometimes if people learn this from their parents or their environment and it just becomes a habit, it can be hard to like rethink this and hard to practice it. And so a therapist can help you identify when you do these things and have exercises to do things differently. So like some people I've heard say, I don't want to go to a therapist because I don't want to dig up all my past. I just need help with these types of things of my day-to-day. There is a way to work on your present moments with a therapist in your present patterns of thinking without going there. If you tell the therapist, I want tools to deal with things and I want to practice more tools. There are all different ways that people work with therapists, and a good therapist can make adjustments based on that, because they're like a partner with you. Another thing that people sometimes will do is catastrophic thinking, when people's minds go to the worst case scenario. So sometimes we all do this at some points where we'll say, well, I'll never get through this situation. And then, of course, if it's a catastrophic thinking and you think, I'm never going to get out of this traffic with this traffic jam and this accident that happened, and I'm never going to make it there on time, then you're going to feel even worse. And it just makes everything in your body ramp up. And so then your heart rate gets faster, your blood starts to pump faster, and you really can't do anything else about the situation. And the truth is, do you think you're really never going to get out of the traffic jam? No, but it just feels like that when it takes a long time. And that happens to everybody. So that's where reality checking can come in. Like, I'm feeling like I'm never going to get out of this traffic jam. Really, is it going to be never? Probably not. So I don't know how long it's going to be. So maybe I could listen to some good music on the radio or something else in the time that I'm waiting to get through the traffic jam. It helps you kind of reset yourself and not actually get your cardiovascular system worked up. Those are ways to help yourself. So these are some of the sources I used. A lot of what I shared was things that I learned over the years working with people. But one of a good source is David Burns wrote a book, When Panic Attacks. And he wrote a book about dealing all with cognitive behavioral therapy and all these different types of strategies you can do to help yourself. He also, you have a book, The New Mood Therapy, back there in the back too, that he also wrote about dealing with both depression and anxiety. And it's medication-free ways to help yourself feel better. But When Panic Attacks is a book that helps with all different types of cognitive behavioral approaches to reducing anxiety. And so that's another source that you could look into if you were interested in learning more. So with that being said, does anyone have any questions? I know it's a lot of information. Everyone's just thinking, are you all okay?
when I'm anxious, and somebody said, why don't you do something? And that right away irritates me.
Mhm. Mhm. So sometimes when you feel anxious and somebody gives you a suggestion right away, it feels like irritating because sometimes you just want to be heard that you're feeling anxious and given a moment to deal with it how you need to. It's all right. I think it also speaks to people's tendency to want to do something to make it better rather than to just sit with it for a minute and let you calm down. We have a tendency to all want to do something to make it better, but sometimes you do just have to sit with it for a few minutes, calm yourself down and do what you need to do. Yeah. So nobody's had any anxiety in here? Mhm,
I know I have recently, I mean, past year,
mhm,
it
mhm,
just seemed like every treatment wasn't worth it.
mhm,
And then I would have to wait another for
Mhm.
6 weeks for the next
Mhm.
test, for the
Mhm.
next,
mhm.
you know, and so I felt very anxious. And I
Right.
got that panic attack. I mean, I was like,
Mhm.
it was very difficult to deal with
Yeah.
and couldn't sleep well.
Mhm. And when you feel like every treatment is not working,
Everyone
then-
tried until I finally got
Right,
away.
right, right. But when you feel like every single one's not working, that makes you feel even worse because then you're like, what if nothing else works? Yeah. Mhm. Mhm.
Then we're gonna do,
Mhm.
you know, try different drugs. And then
Yeah.
we're gonna do like cardio.
Mhm.
And it was just like one thing after.
Yeah, and it feels
It was
easily
very
overwhelming.
anxiety.
Yeah. And I would have to say that some of that is normal anxiety for all of it. Mhm.
Was, but it just
Mhm.
was getting to the point where it was just like, you know, I'm like, I could just feel it feeling worse. And
Mhm.
not just like physically, I'm
Mhm.
feeling worse. Couldn't exercise. I
Mhm.
always
Mhm.
could. And so just feeling really, you know, very, it was hard.
Yeah,
There's
it's
our
really
life,
hard.
you know, and so I feel a lot better now.
Mhm.
That's worse.
Yeah.
Yeah.
And I would say that you did a lot of reality checking in that, feeling like, everything isn't working, but you kept going back and checking with the doctors. Is there something else that could work? And then you got support from them.
I did. It just didn't.
And
you know,
then,
didn't
and
happen.
then, yeah, and then they moved to the next thing.
You feel one thing, wait,
Mhm.
next day, wait.
Yeah, the
and
waiting
on to
is
the
really
next
hard.
test, or, you know,
Yeah,
and so it was just, it was very difficult, but now it's better. So,
yeah, waiting is really hard. And that's also why
It is. and
it's
not
good.
knowing, and
Yeah.
not knowing, but
That's why it's also good to have the mindfulness here and the mindfulness practices, because also mindfulness is something that you can do at home, meditation and mindfulness and things. But when your mind gets hijacked by some of this anxiety, then sometimes it's hard to refocus yourself by yourself. And so having like somebody lead a mindfulness practice can help you stay in that place a little bit better and follow along a little bit better when your mind is getting pulled in these other directions with things. And some of the mindfulness training, there's a saying that one of the reasons why they have you do the breathing is because the mind needs something to also do. Your breath does help support you, but your mind needs something to do. And that our mind is like a monkey and it wanders off. So the monkey mind needs something to do to keep it busy. And so if you focus on your breathing, that gives your mind something to also do that is very supportive and soothing to your body.
mindfulness. That, are they available on the website?
So I believe that that the mindfulness things are available on the website, but I'm going to work on doing some more.
Okay.
And adding them because they have them here once a month. And so I want to do more. Mhm.
Did that. I can't
Mhm.
remember why that gotta have days that,
Mhm.
but that way, but the Zoom, I'm just asking about the general question. The Zoom classes are only live right then. correct?
Yes, but
Okay.
but they do record them. They'll
Okay.
record this, yeah. So
Okay.
they do record them. And so then you can go on the site and you can click and you can play them back. And I think sometimes really having somebody else lead them, I know even for myself, it helps you get yourself out of your own mind where you can focus on it without having to like argue with yourself about taking that time to yourself. It gives you a place and a time that's set that the person sets, and then you can follow some of the things that they say. It's sometimes easy to start with meditation that way, especially if you have a tendency to your mind to wander. But one of the keys of mindfulness is teaching yourself to be in the present moment without judgment. And so a lot of times people will judge themselves as their mind wanders, but recognizing that all of our minds wander and just gently bringing yourself back to the present. And so having someone who helps you practice that, I think can really be key, because the world helps us unpractice that, right? So the same way that the commercials help promote like junk food and things that are not healthy for our body, parts of society also promote things that are not healthy for our minds, to keep us going, like hamsters or whatever, that is really not healthy for us. So then we have to have an exercise routine and support with healthy eating. And the same thing goes true with healthy taking care of our mind for mindfulness. It's helpful for us to support each other and to have exercises and things, practices that we do to help support that too. It's just as important as physical exercise. And I've heard lots of times where people go through also therapy because they have some sort of anxiety and then something else, and they use these strategies, and then something else later will happen in their life and they'll say, I know these strategies, but it's really hard for me to put them into place now all of a sudden. And like, well, you're in a different place in your life and you have different things happening. And so if they go back and they review it, it helps them get back to the place they want to be quicker, because they already have that there, kind of like riding a bike. But sometimes when something in life happens that kind of gets us off of our track, it's helpful to get back on the track. Sometimes we need someone else and a hand to help us with that, and that's okay. That's just like working out. Sometimes you need encouragement to start a new workout routine or a new piece of equipment. Same thing.
I know of a person who's happy all the time. And he's trying to be around her because she's always laughing.
Mhm.
And sometimes get a little bit. Out because that's the saddest thing I ever heard. It's a danger. Yeah. What would you do?
What would I do if somebody was laughing at danger?
No, they're dangerous to themselves. You know, if you don't mind, it doesn't matter. But sometimes she's doing hurt.
Mhm.
She doesn't even realize it. Maybe it's an escape. Makes herself about it a little bit.
Mhm. Mhm. Yeah, it could be a form of avoidance too, right? Because Mhm. Mhm. Yeah, we might not be able to control how other people approach things. So if Mhm. 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 So you might have to cut back the amount of time you spend with that person so that and that's okay too. That's okay. If you feel that way, you can say that to somebody, and I mean that's an honest thing. It's not necessarily judgmental. It can just be an honest observation, and then they can either decide that they want to take your suggestion, or they could decide not to. That's the free country. So it's hard when we can't control other people, I think.
And I think that's the most important part of the mindfulness for me,
Mhm.
is when you cannot control other people that have a, you know, that have a lot of, exhibit a lot of behavioral dysfunction,
Yeah,
then you have no control over that, but you do have control over how you react.
yes.
And that is a lot of what I try to remember. And that's why the mindfulness classes are so important to me,
Mhm.
because getting back to what I can do
Mhm. Yeah,
as opposed to what I cannot do.
yeah. Yep. And it's an ongoing practice thing. Right? Because it's easy to get pulled away from that center. But that's really is true. We can all just encourage each other, but we can't control or change another person. Mhm. As much as sometimes we might like to. Does anybody else have any questions? I know it's a challenging topic, but it's real for real life. It's a very common thing everyone deals with. So,
Thank you, Linda. It was a really timely and excellent presentation.
I think the people in the chat might have had questions.